Welcome, everyone, and thank you for tuning in to Fit Cities, putting health and wellness on the map. Hosted by WOTS Toronto with official book selling provided by Another Story Bookshop. I'm Rebecca Diem, the communications coordinator for WOTS, and I'll be your host this evening. WOTS Toronto is a festival of storytelling, ideas, and imagination, but we're also more than a festival. WOTS is a community. We asked, and you told us what matters most about the WOTS experience: discovery, inspiration, and connection. Our community is creative and resilient, and we're excited to bring the word on the street to you in your homes. Before I turn this over to our panelists, I would like to acknowledge that WOTS Toronto operates on land that is the territory of the Huron-Wendat and Petun First Nation, the Seneca and the Mississaugas of the New Credit First Nation. This territory is the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Haudenosaunee Confederacy and the Confederacy of the Anishinaabeg and Allied Nations to care for and share the resources around the Great Lakes in peace. Toronto is now home to many diverse First Nations, Inuit, and Métis people with long histories on this land. We are privileged to live, work, and create in this territory and must act with awareness and solidarity. We encourage you to educate yourself about the land you occupy, wherever you're tuning in from. For myself, I'm currently on the Saugeen Ojibwe Nation. Tonight is our second event in the free online City Imagine series of discussions about cities and the people who shape them. Before we start, a few words about the next two events in our series. On July 27th, we have a co-presentation with the Festival of Literary Diversity, Black Alchemy: How Our Stories Transform Cities and Spaces, with The Fold's Jael Richardson, musician Drew Brown, author Eternity Martis, and placemaker and author Jay Pitter. Then on Tuesday, August 4th, we're featuring author James Wilt's new book, Do Androids Dream of Electric Cars? Public Transit in the Age of Google, Uber, and Elon Musk, in conversation with Cory Doctorow. You can find more details about both these events at cityimagines.ca. Without further ado, please welcome our moderator for the evening, Jennifer Keesmaat. Jennifer.
Hello, everyone.
Hi. I'm just going to read your bio, Jennifer. I know it's a long one, but you've done so much in your life, and I think that it's important that we recognize how insanely awesome you are. So, Jennifer Keesmaat is passionate about creating places where people flourish, and was named one of the most powerful people in Canada by Maclean's, one of the most influential by Toronto Life, and one of the top women of influence in Canada. Jennifer is a distinguished visitor in residence emeritus at the University of Toronto and continues to share her vision for cities of the future and her belief in the importance of public sector leadership through a variety of publications, including The Guardian, Maclean's, The Globe and Mail, The Toronto Star, and on her podcasts Invisible City and Within Reach. Keesmaat serves on the advisory board of the Urban Land Institute, Toronto, and the International Panel of Experts, Singapore Urban Redevelopment Authority. In 2018, Jennifer founded the Keesmaat Group, a creative group of senior-level urbanists who work with future-oriented cities, regions, companies, and organizations to advance solutions to some of the most pressing challenges of our time: a global housing affordability crisis, the need for mobility in our cities that forgoes dependence on fossil fuels, and smarter, quicker adaptations to a changing climate. Thank you for joining us, Jennifer.
Great to be here.
And our featured guest for this session of the City Imagines is Dr. Karen K. Lee, author of Fit Cities: My Quest to Improve the World's Health and Wellness, including yours. Welcome, Karen.
Thank you so much, Rebecca.
Dr. Karen K. Lee was born in Penang, Malaysia, and moved with her family to Canada at age 8. She studied medicine at the University of Alberta and completed residency training in public health and preventative medicine at the University of Toronto. Dr. Lee is an associate professor of public health and preventative medicine in the Department of Medicine at the University of Alberta. As an advisor, her clients and her partners have included the Heart and Stroke Foundation of Canada, the Australian Heart Foundation, several offices of the World Health Organization, and city, provincial, and state governments and organizations around the world. So that's a mouthful, but I think it really speaks to the fact that both of you have worked extremely hard and are very passionate and knowledgeable about the topics that you are discussing today. So without further ado, I'm going to sign off and leave the conversation to both of you. So thank you very much.
Thanks, Rebecca. Well, my friends, you're in for a real treat this evening because Dr. Lee's book is an exciting treatise on a movement that is actually coming to fruition in this very moment in history, I would argue. And in some ways, Fit Cities was ahead of its time, but a lot of Dr. Lee's work has actually been about pushing our cities in a fundamentally new direction that I think many people are beginning to really grab onto and take hold of in this moment of a pandemic. So we'll talk a little bit about what got Dr. Lee where she is today. We'll talk a bit about her work in cities around the world. We'll talk about the book, of course, Fit Cities, and read from the book as well. But then we'll also talk about this moment and what the book actually means and what Dr. Lee's work means for cities at this moment in history. So what I'd like to do just to kick off the conversation is to ask Dr. Lee to talk about the really unconventional path that she has taken in building this expertise in public health in cities and redesigning cities. And I should just say, by way of introduction, that the book is really divided up into three parts: how we eat, how we move, and how we build. How we build comes before how we move. And our conversation will follow loosely those themes within the book. There's a lot of stories in the book about her work that are incredibly rich, and would like to get some of those stories into the conversation. But maybe, Dr. Lee, you could just begin at the very beginning, that moment that you talk about in the intro, the epiphany that you had, that you care about health. And if you really care about health, what the biggest challenges are that we face to address health, and how that got you into the work you do today.
Thanks, Jennifer. And thanks for those kind words and introduction. Well, I think if we look at the history of public health and the successes that we've seen in historical times. So, in the 1800s, early 1900s, infectious diseases like cholera, tuberculosis, even mosquito-borne diseases like yellow fever, those were some of our leading causes of death. And at that time, we didn't have antibiotics, many of our vaccines. And the way that we actually went about tackling those diseases was through city planning, right? And so urban planning and public health were born at the same time in the 19th century. And by tackling things that we knew propagated these diseases, water and sanitation issues, cleaning up standing water and addressing insects like mosquitoes or, vermin, creating buildings that actually had better ventilation so that light and air could circulate, decreasing overcrowding in both areas of our cities and in our buildings. Those together actually really helped us to fundamentally bring these diseases under control, even before the widespread use of technologies, of medical technologies like antibiotics. So, if you take a city like New York City, where I was working before I returned to Canada, if you look at its history, in the 1800s, the leading causes of death, about 60% of deaths, were infectious diseases. And this is true for many of our cities today. And then by 1940, prior to the widespread use of antibiotics, because penicillin, the first antibiotic, was not discovered until 1939, what did we see? We saw that those rates of deaths from these infectious diseases, because of our sanitation movement, the built environment, the city planning work that we did together with municipalities and urban planners, these diseases had now dropped tremendously. It had gone from 60% of deaths to 11% of deaths even before we started using antibiotics in a widespread way. And so the communities that we design and build are actually fundamental to whether we prevent diseases in the first place and promote health and well-being in folks, or we're left with diseases that we now have to basically attempt to treat after the fact. And so that's very much what we see today, right, is our leading causes of death. I know we're in the midst of a COVID pandemic, but our leading causes of death today are diseases like heart disease and strokes, cancers, diabetes. Now, in the age of the pandemic, these diseases are also really important because if you have these diseases, you're more likely to get a severe infection from COVID and to die from it. And so controlling these diseases are things that we have to do. And the evidence is showing us that we can do so if we were to take a focus on our buildings, our neighborhoods, our streets, and how we design them and how we plan our cities.
It's funny, as you're talking, I'm reminded how very early in the very early on in the pandemic, we were all kind of hanging on the words of our public health officials at the city. And there was a bit of a tension, there was a bit of a debate, because in the city of Toronto in particular, our public health officials were saying, close down parks, stay in your house, don't go outside. And from my work in city planning, I was saying, hold on a minute. People need fresh air, people need to exercise. There's got to actually be a way here of taking an interdisciplinary lens to how we keep people safe. Fast forward several months later, and we've discovered that contagion is something that we have to worry about inside, where there's shared surfaces, when people are in closed environments, as opposed to in places like public parks. As someone who is a proponent of active cities and people being out in the public realm as being foundational to health, not secondary, but foundational, which was the argument that I was making. And I actually had a colleague on Twitter who is actually a professor at a university, I will not name him, who actually said planners shouldn't be engaged in this discussion right now because this is for public health professionals. And I went, what? Like, anyone who knows anything about, as you and I have discussed before, how public health and city design are entwined, knows that in a pandemic, that doesn't go away. It becomes even stronger. How did you, knowing what you know and the work that you've done around fit cities, what did you think when you saw that response to the pandemic very early on that was incredibly misguided?
Well, I think it's, it was well-intentioned in that, yeah. And I think very often what happens is we're reacting to acute things and forgetting that, some of our reactions may actually lead to more harm. I think that's happened even in, I don't think it was the intention of many cities when they became enamored with the automobile, for example, that to, sort of generate pollution and the lack of environmental sustainability, to, decrease physical activity and increase sedentariness. I think those are byproducts of, us reacting to maybe new technologies or this current pandemic. But I'm thrilled to see that, many cities and also I think health professionals have come along since the initial part of the pandemic, where people are being encouraged to go outside, to get the activity, to stay healthy. I have had some recent conversations with health colleagues who work with, endocrinologists, geriatricians. And one of their major worries right now is the social isolation that potentially is coming with some of the physical distancing recommendations. They're seeing seniors populations who were previously healthy becoming unhealthy and frail from the lack of physical activity, from the lack of social connections. So I think, as we try and react to this pandemic and keep it under control, we need to balance it with, ensuring that we don't, that our populations do not become more at risk of severe infection because of issues like inactivity, lack of access to healthy food, and social isolation.
So I think that's what's so interesting about your book is the way in Fit Cities you really take this broad lens. And, there's lots of parts of the book where if I didn't know better, I would say, oh, Dr. Lee's an urban planner. The language that you use and surely the people you've met along your journey are many, many people who we've crisscrossed paths a lot for sure. I'm wondering if maybe you could begin, let's get into your book a little bit by reading from the opening of your book, how you kind of set up the conversation that we're about to have in talking about what wellness and health actually looks like in cities.
Yeah, sure. I'll be happy to do that. And in fact, I was going to say that, I think some of the language that you see, which is urban planning language, it's in there because of the influence of, the colleagues that I've had the privilege of working with.
Nice.
And the interdisciplinary, multidisciplinary partnerships have been such a core part of us making advances in these different cities and stories that I tell in the book. I'm going to read the opening section.
Crack it open. Open.
Well, this one is cracked open. From the initial part of the book, I'm going to start here. All too often, health is considered a personal responsibility. In countless books and articles about diet and exercise, in countless television show segments dedicated to weight loss, to becoming healthy, we're told what we need to change in order to achieve better health. But many of us actually already know these things. In fact, one of health education's major successes of the last several decades is this widespread knowledge of the need to modify our behaviors. We know what we need to do year in and year out. Our top New Year's resolutions are weight loss, more exercise, healthier eating. For many of us, however, it makes no difference. Year in and year out, we are getting less healthy and gaining weight. What's going on? To answer that question, we need to think about those New Year's resolutions again. The whole idea of a resolution is to resolve, to decide firmly on a course of action. We must resolve to make changes. We must choose to do whatever it is in our power in order to succeed. As it turns out, that last part is the key. Whatever is in our power to do. All of our heartfelt and determined resolutions to lose weight, eat better, exercise more in order to become healthier, come with the subtle built-in assumption that we can lose weight if we choose. We can eat better if we choose. We can move more and exercise more if we choose. But what if we can't make that choice? What if it's not actually within our power to do so?
So one of the things I love about that opening is that many years ago, as an urban planner, I had a friend who was studying psychology who introduced me to a book called Choice Theory. And the idea behind choice theory is that everything we do in our lives comes from how we respond to the choices right in front of us. And so I took this idea of choice theory and I applied it to urban planning and asked the question, well, if we want different outcomes in our cities, are we giving people enough choices? Are we giving them enough mobility choices? And you touch on this in the book. You tell the story of a fictional person, a single mother who lives in a food desert. I'm wondering if you can maybe tell that story a bit and the implication from a food perspective of the lack of choice and how that links back into city design.
Yes, absolutely. I want to start about talking about choices. When I talked about sanitation infrastructure as an example, right? It has been such a key and important piece for us before in terms of the control of the diseases and now in the control of our diseases. So we talk all the time about washing your hands during this pandemic, during flu season every year. But you can do that because every building that you go to, whether it's your home, your office, shopping, has restrooms with clean running water, with soap with either paper towels or, a hand dryer. So basically, functionally, when we say to people during issues like the pandemic or every year during flu season, please wash your hands frequently, we are actually equipped to do that because our physical infrastructure allows us to do that. Let's think about all those things that we ask people to do to be healthy so that they can prevent severe infections from infectious diseases or prevent the severe outcomes of issues like diabetes, right? Whether that's heart disease or blindness or, kidney failure needing transplants and dialysis. Well, we're telling people can you please eat more healthily? Can you move more? The reality is, can we do that in every community? So we can wash our hands now in every building in the developed world, right? Wherever we go, for the most part, right? There are still some exceptions, but very few. And but when we say to someone, hey, can you please eat more healthily? So dietitian might counsel the person. And yet, if we look at, the communities in which people live, there are many, many communities that do not have a grocery store or a grocery store within walking distance, right? So what does that mean? Often, for example, in inner city neighborhoods, coupled with the lack of healthy food being available close by, there are also preponderance of unhealthy foods like fast food outlets, convenience stores, right? And so we know that people do the things that are easy to do and we maintain the behaviors that are easy to do, right? In countries where clean water and sanitation are still lacking, infectious diseases are still a leading cause of death, right? But it isn't here anymore outside of this pandemic period because we've changed our environment. So, so when we say to someone, can you please eat healthily? Ideally, they are living in a community where they can go to a farmer's market, go to a grocery store, and buy affordable, healthy produce, as an example. Now, some of our communities do have grocery stores within driving distances, but there are many people who can't necessarily drive for whatever reasons. They're getting older and their eyesight's going. They might have a disability that prevents them from driving, even though they're at a younger age. There are folks who perhaps cannot afford a car, right? And so if there's no grocery store and healthy food access within walking distance, then chances are you're left with the choices that you do have within walking distance. And if those are only fast food outlets and convenience stores, then what are you going to do? You're probably going to do that because that's what you can access easily. Studies show
I've got a great example of that. Many years ago, when I was starting out as a planner and I was a young mom, and I would be rushing home from work, and I took the TTC, and my TTC stop on Roncesvalles, when the door opened up and I spilled out onto the pavement because it was packed in there, I was right in front of a green grocer. So what did I do? I was right in front of a green grocer. That's where the doors opened up.
Yeah.
And so it became a little habit that we would the night before decide what we were going to eat for dinner. And when I got off the streetcar, I literally bought groceries for that evening. I bought them right then and there and walked in. Now imagine in an alternative universe, which exists for many, that there was a Harvey's right there or a McDonald's right there instead of a green grocer. I would have been faced every day with a very different choice. And it truly was a routine that emerged in our lives only because of the convenience, because there was a green grocer serving fresh fruit and vegetables and produce and dairy and everything that we needed right there, right in front of where I exited. In the Regent Park redevelopment in Toronto, which had been a 15-year experience that has really been focused on revitalizing a community that had a tremendous number of disadvantages. If you talk to Mitch Cohen, who is the lead developer, he will tell you about when they did consultations with the community, the number one issue was access to a grocery store, was access to fresh food. So that a big part of that community wellness, it was missing by design. in the way
Yes.
the original Regent Park had been designed.
Yes. And, I think zoning, and planning can potentially be playing a role, right?
Oh, it does play a role.
Yes, absolutely. There are places like Detroit's an example that actually does not allow fast food outlets in the immediate vicinity of schools, right? So that's one of the examples that's talked about in the book. But, I think more than that, we've often, I don't know that we've done enough to define sort of the mix of and the ratios of healthy to unhealthy foods that we should be striving for in every neighborhood. And so because we haven't defined it, it's kind of occurred in a more ad hoc manner, but often I think to the disadvantage of people who live in communities that don't have access to those grocery stores.
You talk about food deserts, and the popularizing that term, I think, has raised awareness amongst planners and other policymakers around the detrimental effects of zoning that is exclusionary and zoning that is too single use. And I think it's played a big role in pushing forward a move towards having neighborhood corner stores and mixed use neighborhoods where people can do a variety of things within walking distance of home. The second part of your book, you actually talk about buildings and how buildings can either promote activity or inactivity. And I remember many years ago hearing about how Bloomberg had this great new policy of redesigning buildings to put the stairs right where you could see them. And then I read your book and went, oh, Dr. Lee was a part of that. And I remember when it was done and being so excited about, that how you design the lobby of a building. Typically, you can't find the stairs. It's the elevator that you see when you first walk in. Tell us a little bit about your work, and in particular, your work with Jeanette Sedek-Kahn in New York City, and how that really shifted how people began to embrace thinking about activity in the city as being a part of health, because that was a really a very creative time when you were able to get a tremendous amount done. And there's all kinds of things in reading that chapter of your book. I also know Andy Wiley Schwartz as well. I gave him a tour on bike in Toronto one year. It was interesting, all these kind of people and initiatives in New York that you were involved in that have really emboldened a lot of other cities around the world, including Latin American cities, to really take on this idea of designing for walking and cycling and recreation and also play in cities. Talk about some of those ideas and really that really rich period of history that you were a part of reshaping mobility in cities.
Yes. I think one of the things that people often say is if New York City can do it, then maybe we can do it too. Because, we have a built-out city, right? But even with a built-out city, you still have to renovate at some point. Your streets are going to need renovations as infrastructure ages. And so, renovation is a prime opportunity for buildings and cities and streets that are already built, but that will at some point have to undergo updates. But when you're actually undertaking new construction, there's also tremendous opportunities to build in a way that addresses the multiple priorities that many of our cities are faced with globally, right? Transportation issues and traffic congestion, poor health, including all of these chronic diseases that I've mentioned before: diabetes, heart disease and strokes, cancers. There are risk factors of inactivity, unhealthy diet, sedentary living, social disconnection. We can address sustainability issues and global climate change issues, like economic development, economic revitalization are often a piece of that as well. You might have heard Jeanette speak about that, but when we were undertaking work in New York, we were trying to achieve all of these outcomes at once. Mm-hmm. And one of the things that we did was, through the different agencies, we were also measuring these different outcomes as we innovated. And so not only did things like bicycle lanes and pedestrian plazas and improved transit, including bus rapid transit, where in areas that were underserved by the subway, as an example. When you expanded this infrastructure, you were able to show not just more pedestrians, not just more cyclists, of course that's increased activity, increased sustainable modes of transportation, but the health department was able to measure things like air pollution in the area. Transportation worked with the businesses in the area, and some of them were willing to supply business data. And so we saw retail sales spike in many of these neighborhoods. Retail vacancies often dropped. And so the economic revitalization that many communities crave and that are needed, and we're now in an era post-COVID that we're going to need that tremendously. Those outcomes can concurrently be achieved, right, by well-designed cities that are actually designed for people and for people to have the most numbers of choices in mobility, the most number of choices in affordable mobility. Yeah, so I don't think, yes, it was a tremendous and a fantastic time. And I think one of the reasons I wrote this book was because I'd often be asked, like, well, how did you guys do that? Or, you know, what's the story behind that? How did you achieve those collaborations? And so the book tells those stories, the behind the scenes partnerships that we forged in order to make these, you know, items from building scale to public realm occur.
You must have kept a great diary, because you were so specific. Then I met with so and so, and we did this, and this, and I was like, whoa! I loved that. But I loved it for the reason that you said, is that when you tell the story of transforming the city, and you talk about all of the players and the different roles that the players played, and the way different players from different sectors came together to move things forward, and even the role that the mayor played at various times.
Yes.
It actually starts to become like a very engaging toolbook, like a handbook, right? Like you start to go, oh, this is actually how you get things done. I'd love for you to read from the second cluster of chapters in your book on how to build, because I think that often we underestimate the impact of building design on those choices that we make every day.
Yes, and I think building design, as you've mentioned, is such an important complementary measure to the public realm. Even in active transportation, right? The facade of the building, particularly on its first two floors, is vital to a good pedestrian experience. The whether your buildings have bicycle parking that's secure is a vital measure of whether people can and will use their bikes and take it to work, as an example, right? And so, and in denser cities where space is at a premium, whether you actually have bicycle storage, even in residential, multi-residential buildings, is such a key piece of the public realm interventions that support even things like active transportation. So I'm going to read from a, go ahead, Jennifer. Yes.
Well, I was just going to add, because of what you were saying, it reminded me of an experience that I had as chief planner. A new school was being built, and the school board came in, and they had built the school with a great big lay-by for cars.
Yes.
Because they'd assumed that children would be dropped off by driving. And they were essentially sterilizing all of the pedestrian realm in front of the school. But more importantly, what they were saying through that design was, drive your children to school. That's what that design said.
Yes.
The design said, the safest and best way, and the way we expect you to bring your children to school, is by driving. Yes. And so we kind of went through this philosophical battle. And, you know, over my dead body was this lay-by going to get approved? Because to me, it was about the values
Yes.
around mobility and around community? Do we value and do we prioritize a child arriving on a bike, or do we say, don't bike, it's unsafe, instead we're going to prioritize cars? But I had forgotten about that, and you telling that story just reminded me. I was incensed that the message was cars matter most instead of children matter most.
Yes.
Because it seemed to me to be pedagogical incongruency to design the building in that way. And yet, if you look across Canada, that's the primary way that entrances to school are framed today. They're framed with laybys, assuming for cars, and they're surrounded by parking lot, assuming that people, well, basically, essentially saying, bring your car here.
That's right.
Arrange your life so that you can drive here. And oh, by the way, we'll even make the parking free.
Yes,
which is
exactly
amazing. But please, we want to hear your reading.
No, not at all. That's really true. I was going to say. I mean, and in so many neighborhoods, right, where you have no options except to drive, and that provides swaths of like basically free parking and nothing else. No transit, sometimes no sidewalk at all. Certainly, very frequently, no safe bicycle infrastructure. And then we say, hey, you know, nobody wants to bike. Nobody bikes, right? And yet,
I was told people don't walk here. People don't walk here. And I said,
right.
Why would they walk? You're basically telling them not to. Why don't we tell people that they'll be prioritized if they walk through how we design the building? Maybe you'll get a different outcome. Well, you and I both know you will get a different outcome. When you make walking safe and pleasant, people do it.
Yeah, I was just going to add one more thing before I read the section on how we build. That hopefully, you know, you'll see touches on food elements, activity elements, but activity not just active transportation, but also active recreation. And then, you know, I think later on in the conversation, hopefully we can talk about the active mobility and transportation piece as well. But my comment was going to be that, you know, I've lost my train of thought as to what my comment is. So maybe I'll just read it and I'll come back to it.
Sure.
Yeah. Okay. So this is an affordable housing project in the South Bronx. The South Bronx is the poorest congressional district in the United States, right? It's a 20-minute subway ride, you know, on the subway from the Upper East Side, which is the richest congressional district in the United States. Anyways, so we worked on this project to improve its design for health with the developer. And the project is called Arbor House in the South Bronx. So this section is called Arbor House, a pie in the sky idea. It's May 2012, and I'm in the middle of a housing tour arranged as part of our annual Fit City conference. I should be paying attention to what's going on around me, but instead I'm fixated on the small package in my hands. It's full of baby bok choy, harvested and bagged that same morning. Sky vegetables, says the label, with the tagline, good for you, good for the planet. Another logo above the package's barcode reads, Pride of New York. The Sky Vegetables venture is aptly named. The epitome of locally grown, the vegetables here are literally grown in the sky, on a high-rise rooftop in the heart of New York City. When farm manager Kate Ahern had handed me her business card along with the bok choy, I couldn't help but marvel at the address, 1071 Tinton Avenue, Bronx, New York. The rooftop of 1071 Tinton Avenue, to be exact. It was a pie-in-the-sky idea that had taken shape and become a reality. This farm on the rooftop of Arbor House, an affordable housing building in the South Bronx. Stifling my desire to nibble on the bok choy right then and there, I tucked the package into my backpack and refocused my attention on Kate and her staff, who are giving us the lowdown on their work. The day before, 20 or so people had signed up for this outing during registration. Fit City, now in its seventh year in 2012, was beginning to attract an international crowd as well as a local one. And since 2010, we've been offering site tours and field visits for interested attendees. The idea was to offer a first-hand look at some of the points of interest that our presentation slides had shown two-dimensionally the day before. We had a varied group today, some from architecture firms around the city, some from city departments, some hospital and healthcare staff, some guests from London, England. Arbor House is impressive. At the entrance, we noted the sign designating it as a non-smoking building. This offers a benefit to residents who don't have to deal with the secondhand smoke that would invariably seep across apartments, and also to the building owner, since smoking cigarettes can create higher maintenance and insurance costs for the building. We'd seen the building's stairs, walls decorated with stenciled art, risers decked out in colorful paint, and the stairwell humming with music. We checked out the fitness room, outdoor exercise equipment, like stationary bikes and ellipticals. Some of us even climbed on them to give them a try. And finally, we made our way to Sky Vegetables, the hydroponic farm on the rooftop, where Kate Ahern had proudly handed out samples of her work. Sunlight pours into the glass of the beautiful, extensive greenhouse, illuminating row upon row of green vegetables. In addition to baby bok choy, there's green leaf lettuce, Boston lettuce, kale. There's a section dedicated to herbs, new plants being tended in smaller trays. There was a rainwater capture bin that helped to make the operation even more environmentally friendly. In 2013, Arbor House opened its doors and the response was overwhelmingly positive. In addition to being platinum certified by LEED, Arbor House was also recognized by the American Cancer Society as a healthy high-rise for its completely smoke-free status. Perhaps the most important accolades, though, came from the building's new residents. In a Time magazine profile, Louis Jurius spoke about how the building's amenities were making a difference to him and to his family. He'd never exercised as a kid, he admitted, but believes that Arbor House is setting up his kids for a lifetime of better health. This will make it second nature for them to be healthy, he told Time. It won't be foreign to them like it was for me. So that's just an example, I think, of, an affordable housing building in the poorest neighborhood in the United States that, despite those odds, had put in place all of these infrastructures. And I think one of the things that really is demonstrated when you have something like an affordable housing building doing such a thing is that it can be done then also in market rate housing. If places with the tightest cost parameters like affordable housing can do this.
What I like so much about that story, in addition to the fact that none of us are really traveling right now, and it made me feel very nostalgic. I felt like I was with you on the tour, the way you wrote it, is that it demonstrates that you can bring a lens that has a multitude of objectives to how we build buildings. That our buildings can be, like, often we trade off objectives. We say, well, this is an affordable housing project. I'm sorry, it can't be LEED Platinum. Or this is an affordable housing project. It's not going to be really high quality. Or, we trade off objectives. And what's so amazing about the Arbor House story is that it brings a whole variety of objectives together successfully. And my understanding is that the urban farms are actually revenue generating. That
That's
they actually they turn a profit, that they generate revenue. So this idea that building in that green infrastructure, again, a multiple objective.
Yes.
Good food for people who live in the building and live nearby, and also generates revenue. So this idea that I think is one of the big themes that is woven through the entire book and through all of your work is this idea that we don't have to trade one objective off of another.
Yes.
And that was, I think, what I was alluding to in my opening comments about this problematic approach at the outset. And I think people were afraid to the approach to the response for COVID, which was, sorry, people are going to be socially isolated. Sorry, you can't be physically active. Those things don't matter anymore. But they actually still do matter. They actually do matter a lot.
Yeah.
And in fact, we're now creating a less resilient population as we continue to stumble our way through this pandemic. We need our population to be as healthy as possible. We need our senior citizens to be strong and healthy in this moment, not weakened because they've been socially isolated and in a tiny little square box and not allowed to exercise for the past 3 months.
Yes.
And so this idea that if you just take one lens to health or one lens to city building, you get wonky outcomes that don't really work. And I think that's something that has pervaded your approach to public health.
I think, this notion of and rather than or, as we think about the outcomes we want to achieve, the things that we can do together, it's and in terms of different sectors. It's and in terms of different outcomes that could be achieved. So they're often not in conflict if we were to plan and design and collaborate well to, achieve the things that we're trying to achieve together.
For sure. So let's actually shift and talk a little bit about how we move, the last big segment of the book, which from my perspective is a huge one. And the question that I want to begin with there is, I want to focus in quite specifically because I think you talk about something that doesn't get enough amplification, which is the state of play and the state of play in cities and how we integrate play and why play matters so much in our cities and the risk to the health of our children if we don't reinvigorate our cities with play. I'm very passionate about this. Have you ever read Last Child in the Woods?
I've certainly heard of it. Yeah.
You will love this book because some of your stories are actually quite similar to the stories that this is a psychologist who talks about children with nature deficit disorder because they're never in nature. They don't understand nature. They're completely disconnected from the natural world. But you kind of get at that with play and how play develops mental capacities. And that children that are just on screens all the time, that there's dimensions that to their health that are missing as a result of that. Can you talk a little bit about what the role of the city is in delivering on and improving the state of play?
I think it's interesting because we talk a lot about, active transportation as being a really important part of active living, which it is. Yeah. But children require much more physical activity than adults do to stay healthy. So, for example, our rates of obesity in children have increased at an even higher pace over the last 30 years than adult obesity rates. So it's tripled, for example, in children between, 1980s and now. So it's almost 40 years now. Children also need 60 minutes a day of moderate to vigorous intensity activity compared to adults need 150 minutes a week. So, that's about 30 minutes, 5 days a week. You can break that up and, do it in smaller bouts and accumulate it. And that's all fine. And, having moderate intensity activity like bicycling, walking are just fine in terms of impacting health. Children need double that amount, right, of physical activity, more than double, 60 minutes every day, right? So that's 420 minutes a week. So that's nearly triple what adults need. And so unless children are still walking, the 5 miles that we hear some of our parents and grandparents talk about that they had to walk to get to school, right? Which isn't happening today. The active recreation components of children's lives is likely also going to be very important in contributing to their total physical activity time. So that can occur in physical education, and studies show that high quality physical education, and by that we mean where children are actually moving for much of the class as opposed to sitting for much of the class, is actually a really important piece of that. However, leisure time activity is also really important. And so we know that, I think it's become more complex I remembered when I was working as a disease detective at the U.S. Centers for Disease Control, there are some stories about that too, about how we went to West Virginia and, did this obesity outbreak.
Good stories.
Yeah. But at that time, the studies were actually showing that, children actually preferred to play than to watch television. Now, we've come a long ways since that time in the early, in the early 2000s when I was there. And now, you have, I think, computer games and screens that are programmed to really, there are more studies suggesting that they're programmed often to be addictive as well, right?
Oh, yeah.
Yeah, but alternative is to actually ensure that we have spaces that are engaging and that can bring children to, playing outside, playing with each other. And there are benefits. For example, there are some studies showing that there are benefits from playing on uneven terrain, right? Terrains that are not merely human-made, but that have natural elements. How we design children's spaces can either maximize physical activity levels or not make as much of a dent, right? And so, simple things and inexpensive things like painting hopscotch markings where you might have just blank asphalt can make a tremendous difference in stimulating children to jump around as opposed to stand around, as an example, right? So there are studies now that are showing us not just the importance of play spaces, but how the designs of these play spaces can maximize versus minimize activity levels in children. There's an excerpt in the book that talks about, the last excerpt I read was in the South Bronx, and we talked about, a really poor neighborhood and how affordable housing can be a solution, how we design what amenities we put in. But there's a story in the book about a very, very wealthy neighborhood in New Jersey where the children are so programmed with screen time. So, parents go to work. Often there are two professional households in this area. They hire a nanny. They buy their children screens. The children are playing on screens most of the day. And because, they have this one action alone for much of their childhood, when they actually get to school, they're actually unable to pick up pencils and erasers. They cannot do things like bear crawls because their muscles are too weak. And so there's actually an occupational therapist hired by the school who has to do gross and fine motor skill development classes for these preschoolers and kindergartners in order to beef up their gross and fine motor skills so they can actually do things like pick up a pencil and write. So it's
mortifying. It's mortifying, but it's also not, in some ways, it's not surprising. I had read years ago when my children were small about children who had no exposure to books and actually not knowing how to flip the pages, and like flipping the pages in a book was something that was starting to become obsolete because everything is done on a screen, which I thought was incredibly shocking. It makes me feel very old school because I used to tell my kids that the sign of a good summer vacation was the amount of time they spent laying in the grass, laying in the grass, looking at the sky. Pretty old school, happy moment. You also talk in the book about the slow streets movement the summer streets movement in New York City. And I'm just wondering if you could link that in for us a little bit to what we see now as slow streets that are emerging as part of COVID-19. In some ways, the summer streets, the cyclova, in some ways it preempted or it laid the groundwork for the slow streets movement that we're seeing now as residents are demanding more
Yes.
space in their neighborhoods for walking and cycling and being safe just as they're out and about moving around. Can you talk about the link between those two?
Absolutely. So, Summer Streets was part of this movement and it's occurring in many cities around the world now. And of course, when New York started it, we were still a fairly early adopter. And so we borrowed the ideas from the ciclovias of Latin America, So for example, Bogota, I talk about that in the book as well.
Yeah.
Bogota, right, has had these ciclovias since the 1970s. And now every week on Sundays and on, holidays, government holidays, they will close 120 kilometers of streets, to cars and open them up for people to walk, cycle, run, skateboard, rollerblade. And along these streets, they actually do recreational stations as well. And so New York started adopting that in the mid-2000s. And we wanted to know, we partnered with transportation, and we also wanted to know, how is this contributing to people's physical activity levels? Were people who are coming out there already just people who were very active? And so we did these intercept surveys of folks and have subsequently published a paper. And we found that the people who came out, about a quarter of them were insufficiently active in their daily lives in regular times. And by coming out there, people were getting approximately half of their weekly recommendations for physical activity met at the Summer Streets. On top of it,
fantastic.
87% were coming there by active modes. So they were walking, cycling, taking transit, and not driving, right? And the evaluations also showed us, though, that it was the people closest who would come to that, right? So people from further away were less likely to come to that. And so we were able to use that data to work with transportation. Transportation subsequently expanded the Summer Streets idea to more place streets and weekend walks, which were smaller block closures in all the boroughs, right, of New York City, and not just this one Park Avenue closure of 7 miles in Manhattan. So that, I think, along with, the experiences of other cities, have really shown us that, it is possible. And, with DOT, transportation, of course, also evaluated what impacts did this have for traffic, because, traffic had to be rerouted and did not find any major impacts, right? So when things are well designed, it doesn't have to have the negative impacts that we think it can have. It can actually have positive impacts if we design and plan an intervention well. And that's like even the closure of Times Square, right? So I think it's really fortunate that more and more cities have been doing this, because now during COVID, there is that opportunity and has been, and many cities have started to do that and have been doing that, where they have closed off, let's say, a lane of traffic to allow more people to walk or cycle or just have more space while they're outside. And let me just say, talking to the community residents, so now I run a project called Housing for Health here at the University of Alberta that is funded by the Public Health Agency of Canada, and we're working, we now have, our partners list has over 100 folks now, mostly from Alberta, but increasingly from across Canada as well, certainly from Saskatchewan and BC. And we're working in partnership to improve housing developments in their surrounding neighborhoods for supporting active living, healthy eating, and social connections. And so as part of that, we're working with community groups as well that work with their residents. And many of them have told us that they would like to see these closures that are occurring in the pandemic now remain after that, right? And so, I think that, when we do these things, we also sometimes are afraid that people won't like it. But in fact, if we plan it well and it's well designed, people love it. And often it can also attract more customers to businesses that are in the area.
Well, it's so funny because, in being an advocate for many years and a designer of streets with bike lanes and communities with cycling infrastructure, for years I've had everything lobbed at me that you can imagine, including people will never cycle to work, people don't have bikes, people don't know how to bike. And when we opened up in Toronto, Lakeshore, during COVID-19 for a Sunday,
Yeah.
You couldn't get a bike in the city. Every bike in the city sold, every bike store in the city sold out. It was absolutely jammed with hundreds of thousands of people over the past several months have been cycling. And so what we've discovered is something very interesting that goes contrary to what people used to say. So think about this for a minute. People like cycling. They have bikes. If we make cycling safe, not only will they bike, they'll do it for fun. So
Yes.
imagine if we created cycling infrastructure so that people could use it as a way to get to work every day. And I've always said, I always feel like I'm cheating when I bike to work. I love biking to work because it feels like I enjoy it so much. It feels like a Saturday. It's a Wednesday, but it feels like a Saturday because I'm pedaling along on my bike, having the time of my life through the city. And so I think that's one of the connections that becomes a part of the future, is that once you experience that in the city and you love it in the city, you don't go back. You don't go back to saying, oh, now let me make the streets unsafe again. Why would you do that? Once you experience safe cycling infrastructure, you don't want it any other way. I have a few questions here that I'm going to jump into. One is about scoring walkability. So the first question for you is, when it comes to walkability, is there a scoring tool or lens that you use to evaluate whether a community is going to be a good walkable place or whether it is going to end up being a walking desert? Is there a tool that you use, something empirical? We've been talking a lot about collecting data.
Yes. Well, there are a lot of different tools out there, as you know, right? One of the most common that's just available and free on the web is like WalkScore.
WalkScore,
right?
Yeah.
And right now we're doing some studies, actually. One of my grad students is doing some studies to look at how well it correlates, for example, to walking in seniors, right?
To see if it's accurate? Like, is it testing WalkScore?
There are studies that have used it in other places, but we're trying to see how does that correlate to seniors walking, for example.
Specifically.
So we're still waiting on those results because it's being conducted right now. But there are also a whole host of other tools out there. And actually, there are tools that measure people's perceptions of walkability. And there are also tools that measure and audit the actual physical environment, right? And then for those tools that actually measure the environments, for example, right now we're working on a tool called MAPS. And there's actually a researcher's version of that tool, which is actually very big. And then there's a community version of the tool, which is a truncated, much shorter version of the tool. So there's actually a whole host. There's like, if you're trying to measure perception of people's perceptions of their environment for walkability or walking friendliness, there are other tools as well that can survey people for their perceived perceptions of how supportive the built environment is. I would encourage folks who are here, if you're a researcher, then reach out to me and we can talk some more. If you are working, let's say, as a planner or a transportation planner or designer, if you are a developer interested in these issues, I would encourage you to work with researchers who are doing research and working in this area, because I don't think that I have enough time to talk about the gamut of tools that are out there. But, if you partner with a researcher and, like, for example, our group is always keen to partner. We can have our grad students or our postdoctoral fellows assist with that. And sometimes we can even write a grant together, right? And then maybe evaluate your project systematically together. Sometimes having an external group, like an academic, evaluate your project may also be viewed with like, wow, oh, that's good. You had someone, sort of more objective help you measure your outcomes. So I'd encourage you, like, if you're not an academic, there may be opportunities to partner with academics who can assist with evaluations and the tools that you might use.
We did this at the City of Toronto when we were building cycling lanes for, we were planning them for Eglinton. We partnered with the University of Toronto and had them undertake research with the small business owners, in part because there was, what we discovered was that the business owners overemphasized and overestimated the number of people that arrived in their stores by car. And that's one of the reasons they were always, fighting for 2 parking spots in front of their business, when in reality, once we collected the data, we were able to demonstrate that a very large percentage of their customers actually arrived on bike and arrived on foot. And once they saw that data, it became a very important and powerful tool in turning people who opposed bike lanes into advocates for bike lanes.
Yes.
The data mattered, and it was some researchers at the University of Toronto who collected that data for us and undertook the study. And it was a very important partnership for us as policymakers to have that research undertaken. Our last question here. The first part, it looks like, is for me. Toronto has made some positive adaptations to its approach to roads, parks, and public space. And the question is whether I would agree. I definitely agree. I think we've been timid. We can go much, much farther. I'd love for us to be bold in this moment. If we're not bold now, when will we be bold? We need a cycling network. We need a cycle lane that runs the entire length of Yonge Street that would connect all of our suburbs through North York, through Midtown, right through down to the waterfront, and would act as a spine. I think we need to shift more to thinking about cycling as being transportation infrastructure, as opposed to just thinking about it as being recreational. So I think we've made some moves, but I think they've been very timid for a city of our scale, and definitely in comparison to the big cities of the world like Milan and Paris and New York, and even the small ones like Oakland, California, have been much more aggressive in creating pedestrian, walking, and active spaces. So we could do that too, but I'm not begrudging what we've done because we've made a start, and it was hard for us to get a little bit of momentum. I'm hoping with that momentum now, we can really transform our city into being a much more livable space. Most of our city is still designed and prioritizes cars. We need a cycling lane right up to Eglinton on Avenue Road as a specific example. The second part of the question is for you, Dr. Lee. Which are some of the cities, and this is funny, was actually going to be my closing question too, so it aligns beautifully. You've worked all over the world. I'm sure you're a city watcher like I am as well. What are some examples of cities around the world that are making really positive adaptations in this moment that we can emulate?
Yes, absolutely. I was going to say, I'm really thrilled to see all the initiatives that have been occurring across Canadian cities currently. And the key is, can we keep this up post-pandemic as well, right? Like all that infrastructure that we have temporarily created, even if we leave them as temporary, as well as, looking to how we can transform them into permanent infrastructure, as you mentioned, Jennifer, for walking, cycling, transit. And what you mentioned about, partnering with academics and showing that, that was this perception amongst businesses that they had most of their customers come by car, but in fact, people were coming by foot and by walking. Even in suburban cities that have undertaken surveys of what people want, when people are asked, what are the types of amenities they want in the communities, very frequently, even in more suburban cities, people talk about wanting to be able to walk to restaurants, to nearby stores. And so it disproportionately shows, like often the vast majority or the majority of people who are answering these questions will actually be aiming for, communities that are walkable and that have smart growth patterns as opposed to sprawling car-oriented, car-only cities. Now, this may have changed from before, but I think there's still the perceptions that how we built cities before is what's desired. But in fact, when a survey is concertedly done in many cities from Australia to Canada, they're finding that people want very different things. In terms of like adaptations from around the world, well, you know, I think we have some of the great cycling cities of Europe that, you know, have managed to make this a major mode share, right? Copenhagen's on track to making cycling a 50% mode share, right, by 2030. And so when I was working in New York, and Jeanette Sidi-Khan and Amanda Burton were like, okay, we want to make cycling a more important part of the city, which we do. One of the things that they did was they went to Copenhagen and Amsterdam and, you know, the great cycling cities to learn, you know, how those infrastructures were put in. And so instead of painting, for example, the bike lane precariously perched between the parked car and the moving traffic, when they came back from Europe, they started to make the bicycle lane between the sidewalk and the parked car, using the parked car as functionally a free or cost, very like a no-cost entity that functioned as a barrier to protect the bicyclist, right? And then of course you don't take away the parking when you use that infrastructure. And so I think if we can learn from the best cities in the world, on the healthy food side, this is a very interesting, it's in the book. Like I have worked with the Singapore government, the Health Promotion Board, on some of their initiatives. And one of the initiatives that they had instituted that I was privileged to see when I went to Singapore was, you know, they wanted, a lot of people there eat street food. And we know that that's very prevalent in Asia. And so what they wanted to do was introduce healthier items into the street food ingredients. So instead of using lard, they wanted people to use healthier oils. Instead of using like regular white noodles, they wanted people to use whole grain noodles. And so they asked if the vendors would, you know, purchase these items. And the vendors, some of them tried and came back with, it's really much more expensive for us to purchase the ingredient, right? And so the government actually, the Singapore Health Promotion Board actually created this initiative where they invited all the interested vendors to work with them. And through them, they organized a collective of coordinated purchasing amongst the street food vendors. So instead of and then they were able to get the cost down to the price of the less healthy ingredients. And now, and then the street food vendors started offering these ingredients to their clients. So
what I love about that example, and it's a perfect example to end on, is it shows how these things don't just happen by accident, but there needs to be collaboration and a vision and strong public policy that will drive healthy outcomes in our cities. That you get fit cities when you are intentional about designing places that will deliver on that outcome. Dr. Lee, thank you so much for your time. I understand that Rebecca is on deck. It's been absolutely thrilling to have this conversation with you, and your book is fabulous. It's wonderful. It's very inspiring, and it's just great storytelling. I really enjoyed it.
Thank you, Jennifer. And thank you, Rebecca, for having us have this session.
Honestly, I'm going to go rewatch it as soon as we're done. Thank you both so much for sharing your insights and your thoughts on this, on the way that public policy and infrastructure impacts the choices that we have available to us. I come from rural Southern Ontario, hence the internet connection. I'm at my parents' home right now. But I actually live in Roncesvalles, and I miss being able to walk to the corner store and the bakery. My sourdough starter is named Mabel for the bakery there. And it's really been interesting sharing like my life in the city versus the, having to drive to the grocery store, the kinds of food that are available to my parents, introducing my parents to avocados, lots of fun stuff like that, yeah, there's a lot to think about. And I really appreciate the work that both of you are doing for us here and in your respective organizations with the Keesmaat Group and Dr. Karen Lee with your grad students, who I'm sure are all tuning in for this to see what work you're loading onto their plates.
I invited other people to join us and for us to help them on their research. So we may be getting more after this.
Exactly. I hope that you get many, many grad students after this. It sounds like you're both doing really important work, and we really value your contribution here. Thank you so much for taking time with us tonight.
My pleasure.
And thank you to everyone tuning in from home. If you would like to order a copy of Fit Cities, please head over to Another Story Bookshop at www.anotherstory.ca. If you registered through Eventbrite, we'll be sending the link in our follow-up email tomorrow. And you can also register for the next event in our City Imagines series, Black Alchemy, How Our Stories Transform Cities, presented in partnership with the Festival of Literary Diversity. That'll be taking next week, Monday, July 27th at 7 p.m. Eastern Time. And after that, we will be having a conversation between author James Wilt and Cory Doctorow on Tuesday, August 4th. Details and registration are available on our social media accounts and at cityimagines.ca. While you're here, please make sure to subscribe to our YouTube channel, like this video, share it with all of your friends, follow us on social media at Toronto WOTS, and to support the Word on the Street Toronto in all the work that we are doing. Even though the festival is going to look a little different this year, we are very, very excited to bring you our first ever virtual Word on the Street festival this September. If you'd like to support our work, you can go to wordonthestreet.ca/Toronto and hit that donate button. Thank you all for joining us and have a great evening.